This week I'm sharing a procedure that's all based around periorbital rejuvenation. How do you make a patient look fresher, younger and happier by treating this area? We're going to cover the lateral lid cheek junction, a small toxin eyebrow lift and a cheek treatment. They're all designed to support the eye and make it, as it should be, the most beautiful part of the face. So, first step, this is a little brow lift. We want to treat orbicularis oculi. We don't want to treat the frontalis muscle because that will cause the opposite, a drop. So if you could just close your eyes tightly for me, squeeze tight, you can see that activity here, we can relax. And this is not specifically to treat lines, but we're going to improve them as well. So I'm going to mark out 4 injection points. This will just cause a little lift in the eyebrow, but you will never get a Spock brow from this kind of treatment. It's much gentler than that. Technique, very important to be superficial. We have a very thin layer of dermis, 2 millimeters. We just pop the needle just under that and it then sits on top of the muscle. Just 1 unit is all we need for a brow lift. And we do those 4 injections. We're sitting just on top of orbicularis oculi. The orbit is then shielded by the muscle and also the membrane that shields the orbit. So the chance of ptosis is very low if you inject very superficially. So I can see a little vein here, that's always worth checking before you inject. We can easily avoid a bruise if we just avoid that. So in terms of treatment design now, I'm going back to what I'm trying to achieve in terms of the aesthetic. I want the angle, the most projected part of the cheek to be here. It's natural as you get older for it to move anterior and inferior, so it's probably about here. If I can add a little bit more curvature here, focusing the cheek, that's going to be very, very beautifying. I then need to have that shape blend in laterally and then blend it into the lower lid cheek junction. So angle of the cheek, I find it easier to palpate this. So feeling for the angle is better than drawing lines on the face and trying to predict where it is. So that's always my first step. And I can feel the greatest projection of the zygoma is on this line, often parallel with the lateral canthus. Then you can use this line here between the root of the helix and the alar base. There's a line that tracks around and that usually crosses at the same point. So that is the point I need to be more projected. Now once I've done that, I know that I'm going to have to also add volume here, and then the sooth muscle, which is slightly depleted, if I can add volume there, it'll create roundness in the whole cheek area. And then we'll blend that back with a couple more injections laterally, most likely, depending on how that goes. Now, I personally prefer having a plan, but then the plan changes as you execute because you'll see things evolve. And I might do something slightly different, but I will have a good reason for each difference, each variation I take off this plan. It's worth just pointing out there's some natural asymmetry. This cheek is fuller and there's less work will be required to harmonize it. This one has a little bit more of an indentation, so that it becomes more apparent as we start to inject. I usually start with projection points, so the point at which the face is defined. You have the gonial angle here, the chin, the nose, the projection of the brow, and the cheek. Those are your key angles in the face. And I'm going to start by projecting out and then blend those in. So I'm looking for a periosteal level injection. Pull back slightly, it might give me a bit more lift. Place that in, touch the bone, aspirate. Give it a second, and then I can start injecting. I'm looking for a response from her of discomfort, which might make me pause and find another spot. That all looks good. Done point 2, come out slowly, and then a little shape. I can now see that projection of the zygoma that I wanted to create. I know that her cheek moves like this, and so the next point will be lateral to that, where there's usually a weak point in the skin. So I'm going to put my next injection just there. Touching periosteum, aspirate. So now I have definition of the zygoma, but you can see it has highlighted the issue we've already pointed out, which is the lateral lid cheek junction. So I'll use a different product to harmonize that in a moment. Let's do one more lateral injection point just to harmonize this and hopefully give a little bit more lift. A little search for the zygoma is normal. Next part of this treatment is the lateral lid cheek junction. I'm feeling for the zygomaticofacial foramen, which is only present in 30% of people, but it's sometimes associated with a small artery. So I want to make sure I preferably can't feel that. I do feel it. Does that feel different to other parts of your skin? A bit more sensitive, a bit more tender?
Let's do it again. No.
No. Sometimes if where the artery is, there's a nerve and it can feel different. Not entirely sure. It doesn't feel most obvious foramen. I've got one myself, so I can actually feel it on my own face. But I'm hopeful we don't. Only present in 30% of people, but I will. If you touch it with a needle, it does obviously hurt because you've got a nerve there. So hopefully it will feel normal. And that's a key point to support. You can see there's a line that actually runs right across that, so if I can support that area, it's going to support that line and also improve the curvature of the whole cheek. So we're through orbicularis, oculi, into the cheek fat. Aspirate. Give it a second and then little bolus. Now you should be able to see that looking less cluttered already. Subtracted that shadow. If you open your eyes for us again. Yep. So I'm also just looking at this part of the lateral lid cheek junction, so more medially. I think I can make an improvement here if we can just place a little bit of product on the periosteum there. Very similar injection. Just edging down. Shouldn't be deep. If you go too deep, you have probably angled your needle to go into the cheek. And we'll do a little bolus. And a little smooth over. Now you should be able to see that cheek is now much more harmonized already. We're flowing easily from one surface to the next instead of having those little bumps and disruptions. So the next thing I want to do is we've now got a very defined cheek, but it's almost a little too defined if you compare with the other side of her face, which obviously is untreated, but I think we need a little bit more roundness in this cheek here to prevent it being too defined, make it fit in. So once you're off the zygoma, if you think about the anatomy here, we're on top of the zygomaticus major, zygomaticus minor, and underneath, just over here, is the infraorbital artery. So we want to be a bit more superficial. This is in the fat rather than on the periosteum. Once you're off that part of the zygoma, we're back to using Voluma intermediate depth. Now I'm looking at when the needle's in, how it changes the shape. That is the shape I want to see, a little bit more roundness. So aspirate, 0.5, come back a little, I can aspirate again, nothing to stop you aspirating twice. Another little bolus. And then we smooth it in. Smooth it, don't move it, as I say. So once again, feel for the angle of the zygoma, looking for that line of projection. And I want to pull back. Touch the periosteum, aspirate. So just like the other side, there's a little fracture line you can often see here. That's where my second injection goes, on the line between the alar base and the root of the helix. I really like that side, but it was the better side already, so I'm using it for inspiration to try and get this side to match. So I'm going to do a little additional bit of volume laterally. So what I'm seeing on this side that I like is nice cheek projection up here, and this side is still a little bit flatter. So I'm going to use a slightly higher G prime product and just try and add a little bit of that elevation. And this is what Maurizio De Maio calls the top model look. It's just an elevated cheekbone. Might as well go through the same hole again if I can avoid a bruise. Aspirate.